Hi, this is Brandy Shantz, and you're listening to Living Chronic. Today I'm here speaking with Anna. She is not just a chronic illness patient, she's also a caregiver with a lot of great insight and some new perspectives. So, welcome, Anna. Thank you for joining me.
Thank you for having me.
So, one of the things I found so interesting about your story is you are a chronic illness patient, you have
hmm
lupus.
Yeah,
You actually have, like many people, you have multiple illnesses, Sjogren's symptoms, and what is that? Sjogren's syndrome is what it's called,
Sjogren's
right?
syndrome.
I've
Yeah,
probably heard it about 1,000 times, but we have what? How many autoimmune diseases are out there, and then they never make them easy to pronounce. So it's amazing that somebody who gets to hear about these all day long still can't get it out of her mouth. Um, but you also have a partner who is suffering from illness, so you're a caregiver as well.
yeah.
What was it like to have those tables turned?
So when I met my partner, Mel was kind of my caregiver,
Mhm.
supported me with a lot of my physical health needs. The pandemic hit, as it did so with so many people, and we both got COVID in September 2020. So before there were any vaccines or treatments or anything available in the UK. And we didn't have that bad of a ride through COVID, to be fair. Like the actual infection itself was okay, but Mel's symptoms kind of progressed from there, got worse and worse. So Mel got a long COVID diagnosis, which has now turned into a fibromyalgia diagnosis,
As they do.
as they do. And it was a real adjustment process for us of going
Mm,
like that role reversal, um, both in terms of how it was just physically divvying up the tasks, things that Mel used to do to support me, then Mel couldn't support me with. So I was there going, oh, okay, now who's going to do them? Uh,
right.
what do we drop? Because there were some things that we just couldn't keep up to the same standard. But also, I think for Mel in particular, that emotional thing of going from being the one giving all the support to suddenly being the one needing the support, not being able to do the things that he used to do for me. That was a really hard adjustment process as well.
hmm Yeah, I think, you know, I've talked to so many people, and I think many of us realize sometimes not until it's a little too late, but it's very difficult not to begin to completely identify with your illness or as
hmm
being a sick person
Yeah.
because it does consume your life so much. So to have those tables turned and be a caregiver, which is also an extremely difficult job,
Mm.
um, I think it presents its own, confusion and almost identity crisis. You're the caregiver, now you're the patient. We're the patient, but now you're also a caregiver.
Yeah.
How do you struggle with that?
I think one of the things that we had going for us is that, oh, my cat has come to join, that I'd already been through the process before. So I'd done a lot of the processing of what it was like to have lupus. Like I'm a well-being and mindset coach, so I'd done a lot of work on kind of not identifying with myself as lupus haver, but kind of living alongside my lupus, kind of how to come to that balance. So I think I
Mhm.
could help Mel with that side of things, like him having me there to kind of go, oh hey, I've spotted this is
Yes.
might be what's going on for you right now. Like, remember, this isn't gonna be like you at your worst is not how you're gonna be every day. There'll be good days, there'll be bad days, there'll be crash days, and that's all just part of the process. I think in some ways that was really an advantage that we had. Um, but there were a lot of times as well, like when I was having a flare, when I was really not feeling very well, and we were kind of looking at the chaos that surrounded us, just going like normally where the person who's in the carer role compensates when there's two of you who are not well. That's its whole unique challenge of just going, well, there's no one to step up now. Like, what do we do?
Right. Um, I feel you because my husband, who also served your look at the kitties, we're animal friendly on this podcast. I've got Sunny in my lap as usual. She can't live without me. This is the best part. I can't tell enough people. If you don't already have an animal, get an animal. That'll help.
Oh God, yeah.
Oh, that's so good, isn't it? But yeah, it's interesting. My husband's been having some GI issues as well,
Hmm.
and it's funny the mentorship seems to be working really well on your end. On my end, my husband's watched me go through everything, and I see him in the same denial I was in. And I'm like, honey, you're in denial. And he's like, no. Like, you watched it happen. But yeah, we go on. I think, oh my gosh, what if we both have Crohn's disease? That's going to be a nightmare
Hmm.
because we're used to having somebody who could pick up the slack when things are bad.
Yeah.
Um, so it really kind of changes the dynamic. And it's like, well, what do we do now?
Hmm. Yeah, and
Uh,
I think because I got my diagnosis before I met Mel, so I was in a previous relationship then,
mhm,
and that relationship was an abusive relationship. There's no putting lipstick on a pig. Like that's what it was. Um, what that meant is that I'd kind of had that model of how not to support your partner through it.
mhm,
And so that kind of gave me, in some ways, like a blueprint of how I wanted to do things, like knowing how I wanted to support Mel, how I wanted to show up for him. I think in other ways, what it meant as well is that I kind of overcompensated a bit. Like I wanted to make sure it was the smoothest ride through a disability diagnosis
I can see.
anyone could have. Like
Mhm.
I wanted him to feel the most loved and supported. And sometimes what that meant is that I wasn't always giving him the space to try things for himself, to do his own process. Like sometimes there was a bit of overcompensation on my end as well. I think because of my
Yeah,
job as well, like what I do is I support people to make changes in their lifestyle. So like there was a little bit of that. I'd be like, Mel would have to be like, "You're in coach mode again, babe. Like, step
get out of it.
step it back. Like, remember your fiance. You're not Coach Anna right now." Because it is so tempting to just be like, "Oh my god, I know how to help someone through this." Like, and just being like, "Yeah, that's not my role here. That's not what I'm here for."
And yes, and I think it's difficult, when you've been through it all. And of course, it's taken us years to get to where we are today.
Hmm.
Um, you want to get other people there
Yeah,
right now, because the past 10 years have been hell. Let me help you get there right now. And, sometimes you just have to let people go through their own process.
yeah,
Sit, let it happen. Tell them you're there when they need you.
yeah. And I think just reassuring him that it didn't change how I felt about him,
Yes.
because such a big part of his identity, like he's a caring guy, he's a doer,
Mm,
he's a fixer. Like a lot of his identity was on how he supported me. That just
mhm.
being there, showing up, and being like, I love you exactly the same as I did pre-COVID, if not more, because we've grown together. We've been through a new
Yeah.
trial. We've
Mm,
discovered new things about ourselves along the way, and that is you can kind of, for some people it's the thing that shows the cracks, drives the wedges apart. For us, it's
yes.
been something that's brought us closer together. So I think we've been really fortunate in that respect, that it has helped us kind of get that new level of intimacy that
Mm,
kind of yeah, it brings a lot of flavor to our life.
yeah. It's so important, though. I think we always worry about our caregivers as much as we worry about ourselves because we
Hmm.
know how difficult it can be. And of course, we worry, is that person going to love us the same?
Hmm.
I've been through it too. We all go through it. Oh my goodness. When that man married me, I was perfectly healthy. Now look at the mess he inherited.
Hmm.
But, that reassurance, that's probably the best advice I think for caregivers. Just
Yeah,
reassure your loved one that you still love them the same as you did when they were healthy.
yeah, and that was something that was very absent from my experience
Mhm.
of like getting diagnosed. Like I started developing symptoms around the time that I got in a relationship with my ex-husband, but I really got sick about halfway through our relationship. My cat is having a wonderful time here dancing around. Um, but he really, it did change how he saw me, how he interacted with me. Like, I didn't have that reassurance. And as the person who was the sick person, it was soul destroying knowing that he saw me as a problem, as an illness, as a bag of symptoms to be kind of frustrated at, rather than a whole person who just happened to be on bed rest at the moment. Like,
Right. And it's already difficult enough going through an illness, but to have that on top of it really
mhm.
is traumatizing.
Yeah, definitely. Like, I have a complex PTSD diagnosis now, and a large part of that, and a large part of what kept me in that traumatic relationship as well, was my disability. Like, there's a lot of evidence that disabled people are much more likely to be in abusive relationships, whether we're disabled beforehand or kind of
Or
trauma itself leads to disability. And then it makes us especially vulnerable. Like, one of the big fears I had was I can't survive without the care that my ex-husband was providing. So yes, it was very traumatic as a relationship to be in at times. Yes, there were
yeah,
many, many toxic things going on, but I was reliant on him for a certain level of day-to-day caregiving that I had to decide when I left to go without, and that was really scary.
frightening. I can't even imagine. Um, because it is difficult. You know that you are a dependent person on some level.
Hmm.
And here in the United States, for many, their spouse, no matter how abusive, may also be their ticket to healthcare.
Yeah.
And where do you go? When you're depending on that healthcare just to stay alive.
Yeah, and I think even in the UK where we have the NHS, it's still
Mhm.
that, like, the benefit system isn't fit for purpose. It doesn't give disabled people enough to live on.
Right.
So
Yeah.
if I couldn't work, I was dependent on him for food. Like, there were times where I really thought my job was under threat because was I well enough to carry on working? But there was that pressure of, can we survive on one salary, knowing that the
Yeah.
benefit system is not fit for purpose? Like, there is that real kind of basic level of needs of, like, healthcare, housing, roof over our heads, that it's it's really entrapping for a lot of disabled people.
It is. And especially, I don't know about the UK and the US, you really kind of have to show that you're in poverty before they're going to give you a
Hmm.
benefit.
Yeah.
And you know what? I just don't even want to get there. As a matter of fact, I would prefer to always work, is what I've
Hmm.
always said. And, we just don't, nobody, none of us. And that's the interesting
Hmm.
thing I've learned in this podcast. I have worked in an international environment in the past, and I've learned a lot about similarities and differences between different countries. What I've learned so much about doing this podcast specifically is disabled people, no matter where you are in the world, we seem to have a lot of the exact same experience.
Yeah.
UK, US, Germany, doesn't matter. We seem to have very similar experiences.
Yeah, my sister-in-law in Australia is going through a very similar thing at the moment. She's been diagnosed with Sjogren's syndrome recently, which in some
Mm.
ways has been lovely for her because she's been able to say, "Hey, sis, like,
Oh,
what's the deal with syndrome? What do I do?" But on another real level, like, listening to her talk about, what do I do if I can't work and we're reliant on just one income? What do I do about this? What do I do about that? The challenges are the same globally, and that's something that I think is we really need to look at as a
hmm.
global society of how we see the rights and needs of disabled people, how we treat our disabled citizens so that we are treated equitably, not just going, well, they've got enough to live on, that's good enough.
Yeah, we shouldn't have to live in poverty just to get some help.
Yeah, I had
And
a conversation with someone a few weeks ago where we were talking about food bank usage, and
mhm,
they were saying that someone they knew was delivering food for a food bank, and they were very upset because the people had a big television. And I was like,
We
you,
do.
yeah, you shouldn't have to pick food or the basics of entertainment that in a
Um,
Western society we take as for granted, as your house has a television in it, if not multiple televisions.
yes, multiple internet,
Mm-hmm.
computers. This is a very modern society. How do they expect us to live? And despite all of that, when I'm in a bad flare and I'm feeling sick, you know what gets me through the other end? Real Housewives. That's the stuff when you don't feel good. Trust me on that. That's
Yeah.
healing. Let's talk about the stuff that's healing beyond medicine: dogs, cats, housewives. The three necessities.
Exactly. Like, where would we be without Netflix?
Yeah, I can't live without it. Sorry, guys. Give me something here. It's just so amazing. And something else I found amazing when we were speaking last week before this recording. Your diagnosis, again, two different places. You're in the UK, I'm in the US. Such a similar experience to what I and so many other chronic illness patients, especially women, go through,
Mm-hmm.
especially women.
Yeah.
And I've talked about this over and over again. 80% of autoimmune patients are women.
Mm-hmm.
So we do get the brunt of this. And
Yeah.
you didn't really find out that you had lupus until you stood there in an office and said, tests now.
Yeah, to the point I'd taken a list of symptoms in. I'd been having symptoms since I was 16. I'd reached 25, 26, and things were getting a lot worse really quickly. I took a list of symptoms in a whole A4 page that I typed out with like, this symptom started on this date, now it looks like. And at the very bottom I'd written, is this lupus? Because,
Mhm.
I could Google. Like, it wasn't subtle what was going on with me.
Let's be frank. I don't know if you've seen it, but I have, with my own eyes, seen in a doctor's office the doctor with his phone Googling
Yeah.
as I'm. Let's not pretend
Yeah,
that we're silly. No.
exactly. So I had this whole I was prepared for this appointment, and it got written off as anxiety. It was like, well, you seem very anxious to have done all this. And it's like, well, yeah, I'm 10 years in and I'm just getting sicker and no one is listening to me.
Mhm.
And so I did I'm not leaving this office until you do the tests. And they called my bluff a little bit, and I sat in the chair a little bit, and then they were like, fine, we'll order the tests.
Mhm.
Um, but it took them another month for me to get another new symptom. I got pericarditis, so the lining of my heart became inflamed. I tried to go back to work after I was working at school. It was the end of the summer vacation. Tried to go back to work, and my heart was inflaming, and rang my GP to say, feels like I'm getting punched in the chest every 20 seconds. This is quite scary. What do I do? And the GP was like, oh, that'll be pericarditis because of your lupus. And I had to be like, I'm sorry, what? What, lupus? That they hadn't even bothered informing me of the test results that had identified an autoimmune condition, let
Wow.
alone initiated the process for treatment or referrals to rheumatology. Because to them, it was seen as, well, she's coped this long, it's livable, she's not dead yet. Like,
Mhm.
how is that good enough that because I'd survived 10 years, I didn't deserve that urgent care in the same way that if, like, not to be stereotypical, but if a man turns up with a tingly left arm, he gets sent to
I
hospital because they think he's having a heart attack. And yet I was there going, my legs won't wait there. I have a rash spreading all over my body. I can't go out in the sunlight. Like, I'm in constant pain. I'm so fatigued I can barely move. And they were like, oh, yeah, but are you dying? Like,
it's
ridiculous.
it's amazing, and it's the same story.
Hmm.
US, UK. It does. We all go through it. I remember I've told this story quite a few times because I mean, it made me mad. I had lost my ability to walk. I had these severe brain issues, forgetfulness. I couldn't speak sometimes.
Hmm.
So I couldn't work. I was having to hand everything over to somebody to take care of that for me. And I told this doctor, hey, I can't work. And I'm meaning this like, fix me yesterday. I need to get back to life. And he said, oh, so let me put this in my notes. So now you're, what do we say, a homemaker? And I thought, oh my God, this man might die today. Because if my husband had come in the office and said that exact same thing, they would have, well, we got to get you back to work immediately. Let's
Hmm.
figure this out. But me, oh, me, homemaker?
Yeah. And that's the thing. I was there. I was a professional woman. I was managing a team at work. I had like master's level education, very competent. And they were like, "Oh, well, maybe you're working too hard." And it was like, in what other world would a 25-year-old be told, "Oh no, you're working too hard. You just need to chill a bit. You're
Yeah.
quite highly strung." I was like, "Yeah,
Yes.
I'm highly strung. My legs stopped working."
Expecting.
You'd be highly strung.
It's just amazing to me. And there's just no sense of urgency when you're going through this.
Hmm.
We we see it. This is my life. I have to get back to living.
Yeah.
But so often doctors, other medical professionals, they're just on their own timeline. Well, maybe we can order some tests. I think we can get you in 3 months.
Mm.
3 months. What world
Yeah.
do you live? And it gets
Yeah.
worse as you get older for some reason. I'm having my kind of midlife thing happening.
Hmm.
I'm like, I'm losing days.
Yeah.
I
But as soon as they can attach the word menopause to it, that
it,
becomes a catch-all net for so many symptoms, right? Like that they can, if it's not weight, if it's not anxiety, it's menopause. The only three illnesses women suffer from.
clearly, clearly, what else could it possibly be? I mean,
And I don't
we've
know
got
about, it's like, I don't know about in the US, but here in the UK, even when you reach like, I've had rheumatologists who've said to me, "Oh, it's your weight. If you lost weight, your symptoms would be better under control." And having to
yeah,
go, okay, how do you suggest I lose weight when I am struggling to walk? I'm putting all my effort into working so that I keep a roof over my head. Like, when am I gonna find the
yeah,
ability to lose weight? And actually, is my weight having a dramatic impact on the pain in my fingers? Like, are my hands so fat they're weighing me down at this point? Or are you actually being a little bit prejudiced?
yes. Well, I had this, a similar esque experience when I was going through my stuff, but it was the opposite. I walked into this endocrinologist office and I said, "Hey," and when I say I walked in, I mean I came in with a cane and kind of
Hmm.
dragging. And I said, "Hey, I was training for Ironman Chattanooga, and next thing I know, this mess." And the doctor ran all these tests on me. And then after he was done, he didn't find anything in his test, but he said, "But you know what? I know there's something wrong with you because you're fit, you're in shape, so there must be something wrong." Normally I get people in here who are fat and lazy, and I'm like, "Get off the couch and put down the bag of chips." And I thought, of course, later I would find out it was my Humira causing this,
Hmm.
which, by the way, doc, if you would have looked away from my fit body and down at the chart, you would have seen the Humira. And I kept thinking, and if I was overweight, he still wouldn't have looked at the Humira on the chart, the actual problem,
Hmm.
and would have just gone straight to, well, got to lose weight.
Yeah. Such a snap judgment, such a physical, that must be it. And actually, like in my case, when I demanded a second opinion, which took me 3 years to get, they found that I had undiagnosed hypermobility and that my joints kept dislocating. Nothing to do with my weight at all. They just
Yes.
missed a part of my diagnosis. And it was only I got sent to a physiotherapist who was like, "Oh, did you know you're hypermobile?" And I was like, "Oh, but I don't meet all 9 of the points on this thing that the doctor did." And they're like, yeah, that scale is outdated. Actually, look how bendy your spine is." And I was like, "Oh, maybe that's causing my neck and shoulder pain."
Jeez. So much that is missed. And I don't even know why sometimes, other
Mhm.
than I just think for some reason, they don't want to listen to women. They don't want to hear us out. And, I've said it a million times, and it's interesting to learn that it's very similar in the UK. You probably wouldn't have to worry about me needing benefits so much if I would get the health care I need immediately so that I
Oh
can
yeah.
just bounce back and get back to life. So much of my time out of work had nothing to do with me per se, and everything to do with the doctors who were taking their time, not doing the
Hmm.
correct test, me having to go see two, three, four doctors saying, hey, you need to do this before I could get somebody to do it.
Yeah. Yeah.
And here we are
Mm.
together, worldwide, women, all experiencing the same problems.
Yeah. Exactly. And what frustrates me the most is it doesn't seem like it's changing.
No, it really isn't. And even among women sometimes.
Hmm.
You know, I'll try to, I'll pick a female doctor, and sometimes it's just as bad. The good news, I think, I've been able to see, at least here in the United States, the younger doctors are
Hmm.
far more likely to really listen to you. I think they're doing something different in med schools. Or
Mm.
maybe these young doctors have grown up watching. Somebody else mentioned maybe it's all the medical shows, where they see that the doctor just didn't listen to something, was too busy doing something else, and then in comes the nurse and she saves the day. Maybe they saw that so many times that they thought, maybe I should talk to this patient.
I did think though when I got my lupus diagnosis, there was a little bit of that house MD moment of like, is it lupus? I wondered if the doctor was like, it's never lupus, because that's exactly what my brother said to me as soon as I said it was lupus, that they'd finally got the answer. He was like, ha, what is it really? And I was like, no,
Really lupus.
it's actually lupus this time. Um,
Yeah.
but the other thing I think that plays into it a lot, Brandy, because my training, I'm a speech and language pathologist, so I've gone through a medical education as well, is that I think a lot of the problem is that the good doctors burn out. The ones who
Yes.
do go above and beyond for their patients, the ones who are wanting the best, who are trying, they get exhausted by working in a system that doesn't care, that is underfunded in the UK for sure, is underfunded, that is understaffed. Like they do their best until they're on their knees and then they can't anymore. And what you're left with after a certain age is the ones who've emotionally checked out,
Yep.
the ones who are complacent, the ones who skate through the day by going, oh, she's fat, don't need to do anything about that other than prescribe. Like, I was offered weight loss tablets where they were told, oh, you'll lose the tablets because it gives you constant diarrhea. And I was like, I have IBS. I don't need
So
that. I'm good, thanks. Like, I would quite like an answer to why my hands hurt, not to just someone say, would you like to lose weight through tablets that make your body void all fat? Like,
I
how
think
would
you
that be a solution at all? But it's quick. It's a 5-minute consultation, not a 20-minute consultation.
get them in, get them out. That's the
Hmm.
biggest difference. Same here in the United States. And I've learned these doctors, they have quotas they have to meet.
Mm,
Over
yeah,
here, it's a for-profit system. So whoever's running the practice, we have a lot of chain practices here that are, nationwide. The hospitals are the same. You're a doctor, you have to see X number of patients every day. You have to do X
yeah.
number of procedures every month. You have all these metrics that you have to hit, which is insane.
Hmm.
Why does my doctor have a metric for number of colonoscopies he has to perform? What if all of his patients are
Ridiculous.
young? Like this is silly. So we have the same problem, a little bit different. I noticed very quickly, I ended up switching all of my medical care to government health care.
Hmm.
Specifically, VA is where I'm doing the majority of my um, things, whatever it may be, with the exception of a couple of doctors I see at Walter Reed, which is our military hospital.
Hmm.
But I immediately noticed that these doctors take time.
Yeah.
My primary care at the Veterans Affairs Hospital, he just blocked off 45 minutes for me one day. He
Hmm.
said, let's just start going through this. Let's figure stuff out. And he was writing referrals. We were talking through what I was experiencing. And I realized nobody in the United States of America, unless you're paying a lot of money for, say, a
Hmm.
concierge, gets that kind of care. So it's the
Yeah.
same.
And it's the same here. The doctors get 10 minutes in a general practitioner's office. They get 10 minutes to see you. And in a lot of doctors' offices, they have you're allowed to bring one symptom, one problem. And it's like,
Yes,
what about the complex people like us who have
yes,
15 problems? Do we make
yes.
15 appointments?
Make
Like,
another appointment. But it took me 3 months to get this one. Why? Yes, same. And it's interesting. Now, we're not going to have time to go into this. We'll have to make a whole nother episode, maybe even a series about it. But how quickly they want to just dismiss you and prescribe a drug.
mm-hmm. Yeah.
Obviously, I have a very specific viewpoint because I had a very severe reaction to a medication I was on. I had actually gone back to my prescribing doctor and said, "Hey, I don't think this is working and it's making me feel like this." And
Mm-hmm.
he said, "No, you're wrong. Stay on your medication." And then, of course, it ended up causing a very severe reaction and lifelong problems. Thank you, doc.
Mm-hmm.
But you're seeing it now. I don't know if you guys have the same craze over in the UK, but in the US, everybody's on Ozempic.
Mm-hmm.
There's problems. Go on Ozempic. Well, it's already, I think, did you even ask about the side effects? It just got approved by the FDA not long ago.
Mm-hmm.
Take it from somebody who got an experimental drug that started adding on black box warnings year after year after year because they're like, oh, we didn't know that one was happening. Wow, now our patients have multiple sclerosis. Well, ain't that a bitch, I mean, but nobody told me up front,
Yeah.
but they're so because they have 10 minutes. So what are you going to do? Prescribe you a drug.
Yeah. And then when you come with side effects, I will prescribe you a different drug for the next lot of side effects. And then, oh,
Well,
that's had side effects. Oh, here's another drug to manage those side effects. Like you end up on like chain reactions of things where you're like, the drug that manages one thing causes this side effect. So then you're on this, but that causes this side effect. And actually, one thing is dealing with your chronic condition, and the other three things are dealing with the impact of that medication. But there's no look at like, so for me, kind of with my background in being a survivor of domestic abuse, there's no look at, hey, how's your trauma affecting you? Because like from a medical knowledge standpoint, we know that trauma increases your cortisol, your adrenaline in your system. Chronic cortisol and adrenaline levels cause inflammation. Inflammation causes autoimmune conditions. Where's the trauma therapy in all this? Where's the somatic healing work that like they have evidence works?
tons.
But yeah, you don't get funding from a pharmaceutical company for it. So why would we prioritize it?
Oh, how depressing that we have the same problems in two different countries. Who figures this out?
Mm-hmm.
Yeah. Can we get an international body together to say, hey, got to do something? My goodness. And it's
Yeah.
interesting. I've done a lot of great podcast interviews with people who have gotten better
Mm-hmm.
through that kind of therapy. Um, I've spoken with medical professionals who deal almost entirely in trauma and its
Mm-hmm.
effects on the body and chronic pain. And there's an interview that will be, I believe it's my next episode coming out with a doctor who has researched cannabis
Mm. Yeah.
and many benefits of that. And, for somebody like me, somebody like you, the benefits are amazing. He has done research and shown that Crohn's patients can get into remission with cannabis, except you're not immunocompromised.
Mm-hmm.
Imagine what that could have done for us in 2020.
Right? Like, and this is what really frustrates me. And I do think you're right that it's about like not to get all anti-capitalist here, but I'm gonna.
Yeah,
Um,
I'm not a capitalist. Trust me, I like nice things. But
yeah, but it's about who gets the money. With cannabis,
yes,
you can grow your treatment yourself. No one gets the money in that situation. With trauma therapy, it like there's a certain amount that you can DIY. No one gets the money. And the thing that I think sits at the root of it as well is where the decision making lies. So again, in my
absolutely.
background in being a speech pathologist, I worked in autism research for a while. And autism research is a really interesting place to work as a neurodiverse person, because what you see in the neurodiversity community is that there's the traditional research which has been done by neurotypical people, and there's this growing field of autism research that's been done by autistic people.
Oh,
And
amazing.
the differences in how those treatments are focused, that it's not about cure, it's not about like symptoms management, it's about quality of life, it's about how you feel about yourself, about self-esteem, about preventing suicide, about helping young
Hmm.
people who get their diagnosis accept and understand themselves and value their skills as an autistic people. And you think, oh, it like look at what the autistic community is showing us about when the patients are at the center of driving the research priorities, the focus
That's
is different. And I think that like the autoimmune community has a lot to learn from that. Of like
that's
Lupus UK do amazing work fundraising to fund lupus research,
yeah.
but it's not far enough. We need lupus patients on those boards, like talking on the like universities and in the hospital research hospitals, going, this is what we want you to focus on. This is what, like, don't just tell us, oh, actually this is the drug that will help your fatigue a bit more than the other one. Like, find out what actually helps fatigue in lupus, find out what actually helps us deal with our photosensitivity, so that we can exercise, we can get out, like, do the stuff that matters to the patients, and you'll probably make the breakthroughs in the other areas as well, because the science underlying it will be the same, but you'll
Yeah.
be doing it from a standpoint that is actually patient centered. And I think we've got to step up our activism and find the energy from somewhere, like find the
Yes.
spoons to get in these rooms, because otherwise we're just going to carry on being given Humira and given Plaquenil and told to deal with the fact that all our hair's fallen out and our stomach acid is out of control.
That's, I can't think of a better way to say it. I can't think of a better way to draw to a close, because that's what it's about. Make this patient centric.
Yeah.
Give us a say.
Hmm.
Put us in the room where it happens. And you are doing a lot of work to help that out as well. You have a
Yes.
business, you have a podcast. Tell me a little bit about that before we go.
Yeah, so my business is actually links on really well. It was a very nice segue. I help activists to do their activism in a way that feels easy. So many people's change-making missions comes from their lived experience. I started out
Mhm.
being a domestic violence activist because I experienced domestic violence. I do
Yes.
disability activism because I'm disabled. Like, our lived experience takes us to these change-making paths. And kind of what we've learned about ourselves through the conditioning that we're taught, we're lazy, we're this, we're that,
Mhm.
it gets in our way. So I
Mhm.
help people unpick that about themselves. I help them get back to self-love and easy activism. And so my podcast is with a public health doctor in the UK as well, looking at the power of love. So I look at it from a self-love perspective of how you can do your activism fueled by self-love. And Rachel brings the how we can bring love into public systems like healthcare, like policing,
Mhm.
like violence reduction, um, so that that's informed by love as well. So we're called Love Audaciously, and we launched quite recently. So you'll be joining us at the beginning of our podcasting journey, but our conversations are all about things like boundaries, love as an action, putting aside thoughts of being selfish to root your self-care in everything you do, how to find your vision, how to find your mission, how to make change making easy so that it doesn't feel like, oh my God, to get in that room where it happens is going to be a full-time job. It's going to exhaust me. Like, to do it with
Mhm.
fun and ease and grace and just make it feel good. Because that's what we need at the end of life, is to feel loved and feel good.
Yeah, absolutely. I really love the work you're doing. I'd love to have you back. Maybe even your partner. We can do a whole nother interviewer two or
I would
three,
love
or
that.
so much work to do. I just love it. So love audaciously.
Love Audaciously.
My speaking today has been a little miffed, but it's okay. It happens. I always tell people I do this thing when I feel good. I do this when I don't feel good. So,
Yeah,
um, you know, it happens sometimes. So I've been having trouble speaking, but I got it. Love audaciously, and thank
yeah.
you so much.
It's
I
been a
I can't tell you
pleasure.
how great this is, and I can't wait to do another and for us to work together and make the change.
I love it. I'm in.
Thank you.
Thank you for having me.